This week, a well-known social media creator, Gabbie Hanna, publicly went through what appears to be a severe episode of mania or perhaps even psychosis. In the span of about 3 days, she posted well over 300 TikToks, the content of which are erratic, dangerous, and quite difficult to watch. This public mental health crisis caused millions of followers to leave comments concerned for her safety, asking the question over and over again, why is nobody helping her? And the simplest answer to that question is no one is helping because in the majority of the United States, we don't have anyone to help individuals going through mental health crises such as these. Today, we take a look at the state of mental health in the United States, exploring why nobody came to help her and others like her, and what would have happened even if someone did try to come and intervene. Because to fix a problem, and this is a problem, we first must understand it. Let's get started. Hey there, friends. If you're new, I'm Liz. I am a family nurse practitioner, and I have seen so many individuals in mental health crisis. I've seen it way too often as a primary care provider and as a bedside nurse in the last 10 years of my career. And when I started getting tagged in all of these videos of Gabbie, people were saying like, what can we do? What can we do? My heart, it just sank. First, because I can't imagine how uncomfortable and unfair it is to be going through a mental health crisis so publicly. And two, because the answer of what can we do is not much. Our mental health care system in the United States is broken. And I've seen endless suffering from people who went through crisis or watched a loved one go through crisis and desperately asked me the same questions. What on earth can I do? Only for me to have absolutely nothing to offer them other than a sympathetic listening ear. Today, I wanted to give you a glimpse inside the mental health care system in the United States. Let's explore why Gabbie and others who have had the same exact story don't get the help they need. And if you stick around until the end, I'll share an actionable step that you can take today to start making a change in our mental health system. What I won't be doing here, though, is diagnosing any medical conditions, showing the videos that she posted, or tolerating any hate comments about her. My goal is for you to gain a better understanding of a side of healthcare you may not be familiar with so that you can get just as mad as me and together we can change the world. So since we're using Gabbie as our hypothetical launching point today, let's start by identifying the possible cause of these symptoms, right? To me, the behaviors Gabbie displayed align closely with someone presenting in a state of mania or psychosis, which can occur as an individual event all by itself or as a part of an underlying mental health condition such as bipolar disorder, schizoaffective disorder, or substance use disorder. And when evaluating someone for a manic episode, healthcare providers will look for at least 3 of the following symptoms, as well as like other things going on. But the symptoms being someone who's abnormally upbeat, really jumpy or wired, increase in activity, energy, or agitation, an exaggerated self of well-being and self-confidence, and this can look like complete euphoria, decreased need for sleep, unusual talkativeness, racing thoughts, distractibility, and poor decision-making. And some of this might sound like, oh, that doesn't sound half bad. And in fact, many people with mild symptoms often just appear super productive and energized until you really take a closer look and see the unhealthy aspects of the behaviors, such as lack of sleep, not feeding oneself, or engaging in risky behaviors that are abnormal for them. Individuals may also exhibit much more unnerving symptoms, such as those we've seen in a lot of Gabbie's videos, where her symptoms are a lot more severe, and those with severe symptoms can even cross the line into kind of a psychosis, where someone would have hallucinations and experience a complete break from reality. In her recent TikToks, Gabbie unfortunately exhibited many signs on the checklist of mania and even psychosis. There is often a religious aspect with severe mania or psychosis, and I've had many patients in a crisis state present thinking that they themselves are God or they have a special connection and communication with God, and they were sent here as a messenger to facilitate help to the world. This is usually assisted through an inanimate object that they're fixated on, such as like a television or a microwave. And Gabbie stated in her videos that she believed she was the second coming of Jesus Christ and had spent the night in heaven and was now back to save the world. She also invited a stranger into the house to hang out, and he ended up filming the experience and putting it on his own TikTok, which is an example of really reckless behavior that often accompanies acute mania. She also produced some tangential monologues lasting throughout the night with no apparent need to sleep, which further points to being in a state of mania or psychosis. And many, many, many humans on the internet have picked up on this behavior and identified it as concerning. And some of those concerned individuals have contacted the local police department to call in safety checks on Gabbie, only to be disappointed when the officers checked in and left without any further intervention. The general consensus has been incredible frustration at the lack of willingness to help a person who, by all accounts, when you look at it, is so clearly not okay. But the police officers, they did nothing wrong here. Gabbie Hanna was not in a state that required intervention by the standards put forth in California law. And before we dive into explaining how that could possibly be true in a case like this, can we just all collectively take a minute and stop and realize how absurd it is that wellness checks, which are often for like the mental health assessment of someone, are primarily done by police officers in this country? Because most counties do not have emergency mental health providers like a social worker, the police have taken on the role of being the first responders to mental health crisis, which is challenging because most police officers don't have much training in assessing or handling mental health crisis, as that is literally an entirely separate profession and specialty. And for many, the presence of the police in general causes anxiety and irritation, which only adds to the already strained mental health of the individual in the crisis. Lastly, police are armed with weapons and are usually trained to disable threats in a very physical way, which is not good news when approaching an often hostile and unpredictable, irrational individual in the throes of psychosis or mania. When I rule the world, friends, wellness checks will be performed by trained mental health professionals who do have the training to meet people where they are at, who don't add extra stress to the situation, which is in no way an insult to police officers. I think it would just simply be a better fit for the situation, in my opinion. But back to the wellness checks themselves and how it's determined when someone should be forced into an observation period for a mental health crisis. Wellness or welfare checks are when the police stop by a person's home or living environment to make sure that they are okay. If there is a medical emergency, such as the individual is found laying on the ground with a broken leg, the police can then call an ambulance to have the patient taken to the hospital. But what happens when they encounter someone in a mental health crisis who, like most people in mania or psychosis, don't believe that anything is wrong with them at all? In fact, most people usually experiencing mania or psychosis think they're living like their literal best life. Remember the euphoria we talked about? It's potent. So most people won't be turning themselves in for observation willingly because they think they feel great. So at what point can the police forcibly remove the individual from their environment and admit them to care for an involuntary hold? In order for someone to meet the qualifications for an involuntary hold, also, you'll commonly hear this called a 5150. The individual in crisis must meet the state-specific requirements. In general, the two guiding principles here nationwide are the person must be clear, danger to themselves or others, and this has to be backed up with evidence that they have an actual thought out plan to do something, that they have the means to do it, and then they in fact do intend to carry out the plan. Simply exhibiting general unnerving behavior, making cryptic allusions in a TikTok, or even admitting that you want to harm yourself or someone else but not having a plan or the means to do so will not prompt an involuntary admission. California does have an additional stipulation here that individuals may be detained if they appear gravely disabled, meaning they are unable to provide for their basic needs for food, shelter, and clothing. But an individual like Gabbie would not qualify for these as she was in her own home, had access to food, and even though she was not always clothed, she had access to clothes. So while Gabbie's behavior was alarming and unsettling, she never made clear plans, or at least expressed them, of how she was going to harm herself or others. And therefore, with our system, there were no grounds to take her in for mandatory observation. And if you're anything like me, you may be thinking, but why on earth are the rules so narrow in scope? That leaves a ton of people out who really could use help. And my friend, I was absolutely with you thinking that we need to get more people help, even if they don't think they need help for their mental health crisis. because that is obviously what they need. And that was until I really worked in the hospital and I realized that there really is very little help for those people who are held for 72 hours. In reality, this is what a 72-hour hold looks like. In most places in this country, when an individual gets taken for an involuntary hold, the primary goal is not to provide treatment, but instead to stabilize and keep them safe. Often they are taken to a local emergency room, which may or may not have a psych crisis center in it. Most don't. And they will then sit in the overcrowded emergency room for up to 72 hours. During that time, someone should come by and do an evaluation of their mental state. This may or may not be a trained mental health professional, depending on if one is even available or exists in that area, because in many parts of the rural country, there are literally no mental health providers. An individual will then be monitored on a one-to-one basis with a patient attendant for safety and routinely checked on by other staff, but there's no actual help being given at this time, usually. Sometimes the person stays in the ER for the full duration of the 72 hours, and sometimes they are admitted up to a medical floor where a nurse like me had absolutely no training on how to best help the patient, so they sit in a room alone with a stranger for the whole time, isolated, because they usually can't have access to like their phone or anything. And then when the 72 hours are up, the medical team that may not even have a psych professional on it will again evaluate the person, and they will choose one of three things. The medical team can decide to discharge the patient. The patient can then decide to voluntarily readmit themselves for further monitoring, or third, they can implement an extension of the hold for something like 14 days. The last option is pretty rare, as it involves appealing to an ethics board or a judge, depending on where you live, and usually requires like a ton of paperwork, and it's not as common. And even if the individual does decide or is ordered to stay inpatient, it often takes weeks to get into an inpatient psych institution because they are rapidly closing throughout the country. So the individual may be left sitting on a regular hospital floor with nurses and a healthcare team that don't really know what to do with them, but awkwardly come in a few times and ask, "So, how are you today?" while crossing all of their fingers that they will somehow get a psych bed and go somewhere where they actually know how to help them. But the reality is that most people will spend this entire time, even the 14 days, without any treatment. But at least we kept you safe, right? And we also probably scarred you in the process, because the hospital is isolating, adding to your mental stress. I think we've proven that, oh boy, inpatient, unless in a specific psych facility, which is very rare, is a hot mess. But let's just back up a second and explore what would happen if they said, okay, you can go home. Maybe that will be better. So if the patient is discharged after their stay, where remember, they were not treated, they were just monitored for safety, the patient is told to follow up with their primary care provider and psych. Now, I worked for 3 years as a primary care provider and have had many of these post-crisis hold visits from my patients. And they were some of the hardest because I felt like my hands were completely tied. The patient would come in and they would explain the situation, and I would call every psych provider in the area trying to get them in for an appointment. Now, keep in mind that typically in our area, the appointment time wait to get an appointment with psych was 10 months. But if you begged, you could sometimes get something within the month. And it's not just that area, this is all over. I now live in a totally different state, and I'm currently waiting 11 months for my appointment with a psychiatric professional. So that's cool. Some states have implemented laws like California that require patients to be seen for an intake assessment at a psych office within 10 days of the request and within 48 hours of urgent cases, which sounds really great, right? In theory. However, after this initial meeting, many people then have to wait months to have the next follow-up appointment. And what good is, oh yes, you have very severe depression, we can start to help you with in, let's see, 5 months? Does that sound good? Not really helpful. So why is it so hard to get an appointment with a psychiatric mental health professional? Like with most things, there are a lot of factors at play in the supply and demand debacle here. First, there are more patients than ever, and they are sicker, so their cases require more time and energy. And there are more patients than ever because the prevalence of psychiatric illness is increasing, both from an increased awareness of mental health being a thing, which is great, but also from the world just being insane and the pandemic. There's a lot. And people are sicker because our system doesn't prioritize early intervention and prevention when symptoms first begin and start. Many people can't even afford to get into care or are completely overwhelmed with the thought of a 10-month wait to seek care. so they don't bother seeking it at all. Or their insurance doesn't cover early treatments, or who even knows what. There's so many reasons people don't get access to care in this country. And this leads to people showing up when their mental health has reached a crisis point, when it is so much harder to manage versus if it had been treated when symptoms first appeared and were more mild. So that's the demand side of things. There's a huge demand of mental health services, right? So why isn't the supply of mental health providers matching up to the demand? Again, many reasons. Here's some of the most common ones. Due to the high intensity with which many people enter the mental health system, many psych providers burn out, right? If every single human you see is a severe case due to how long they've had to wait to see you, it's like firefighting constant fires everywhere. And no matter how hard you help, there's always more phone calls of other emergencies begging to come in and see you, but you don't even have time to deal with the emergencies that you do have. And sometimes it's just nice to have a run-of-the-mill case, but we don't even have space for those because everything is an emergency. And to add to the stress of the job, reimbursement rates from things like Medicaid are quite poor for a lot of the services. And there's a lot of paperwork and hoops to jump through. So providers aren't being well compensated for when they do see Medicaid patients. So for a lot of providers, they just decide it's not worth the hassle and they open up their own private practice where they get to decide what insurance they take, if they want to take it at all, because a lot of people are going the cash option. And almost none, when they do this, choose Medicaid because they did this to get away from the poor reimbursement model of Medicaid and what they offer. So this leaves an enormous lack of access to psych care for those in the Medicaid population who now have very few providers who even accept their insurance, and on top of that are usually facing very difficult social situations that make maintaining one's mental health challenging even with appropriate intervention. But if you have private insurance or can pay out of pocket, you should be fine, right? Well, not so much. See, when someone is in private practice, they get to decide who they treat and won't treat. And I have had so many patients returned to my office after being discharged from their psych practice because they were too manipulative or disagreeable. So they were discharged from the psych practice, which means they can't go back, for exhibiting signs of the mental illness that I sent them there for, which then sends them down the path of finding a provider through either another one where the wait is very long or through community mental health where the wait is even longer. And usually in the interim, trying to have me, their primary care provider, try to help them with a condition that belongs in a specialty for a reason and deserves to be treated by someone who is specially trained. So now they are living in a constant state of dysregulation, right? It's going to lead to things like they have a hard time holding a job down. They can no longer pay for their car. They are in unstable housing. Their behavior has chased away many of those close to them. And all of this instability feeds back into their worsening mental health until another crisis occurs and the cycle begins again. Oof. How are you doing? Are you doing okay? All right, because there's a little bit more bad news. Hang in there. We also have a shortage of providers in the mental health arena, leading to more than 150 million people currently living in a mental health professional shortage area in the US. And it doesn't look like it's improving anytime soon. With more than 60% of the current psychiatrists being 55 and older currently, they're about to retire. So soon we will not have them. That's not ideal. And the American Association of Medical Colleges anticipates that in the next few years, we will be short between 14,000 and 31,000 mental health providers, with those living in rural areas being the most affected. And that number, it just seems like a lot. Since the system is already failing as it is, it's not what we want to hear. And I know there's going to be some optimists out there like, Liz, this isn't a big deal. Let's just train more psychiatrists and mental health providers. And my friend, if only it was that easy. In order for physicians to become psychiatrists, they must graduate from medical school and then go to psych residency. But there are only so many psych residency spots. And Medicaid determines how many residency spots there will be and pays for those spots. And they can't just add more because we need more. You have to first go and send bills and acts through the government and get them approved. And when approached with these requests, legislators tend to just see immense dollar signs and they decline it. So the system is kind of capped. And yes, other mental health providers are being turned out, but schools are also limited on how many students they can graduate based on having open clinical spots. Because as it happens, burned out mental health providers don't want to accept students when they are already overwhelmed, which is totally understandable. And that is why the AAMC is not overly optimistic when looking at the future of psychiatry providers and the shortage that we face. And that, my friends, is the answer to why no one is helping Gabbie Hanna. Because unless someone is explicitly outlining dangerous plans, it has been decided that they are well enough to remain in their home rather than entering a system that is not equipped to handle their condition. A system that very well may in fact make that person worse, because I promise, I have probably made psych patients worse when I attempted to care for them and was so out of my depth and probably said or acted in a harmful way. Those actions weren't intentional, but because I did not have the specialized training needed to help them and no one else was there, they did not get the care that they deserved. Our mental health system is deeply broken, and I'm in no way advocating for you not to speak up and seek help when you need it. Please, please, please seek treatment when you need it. There are many, many phenomenal mental health providers out there fighting every single day to help people, and you may find yourself with one of them. And the goal of this video is not in any way to dissuade anyone from accessing mental health services. I am so in favor of those services. The goal was simply to show that for many, that mental health care is not available, leaving the care of those with mental health conditions to friends and family, who not everyone has. And you can imagine the consequences there when they don't have people. But what if you are that person who loves someone with a mental illness? What can you do? Be there. Just be there. If you love someone experiencing someone like this, the best thing you can do is just be with them. Love them through it and keep them safe. Mania is dangerous because it can remove all inhibitions and lead to risky behaviors. But what comes after mania is sometimes even more dangerous. Mental health disorders like bipolar disorder are kind of like a roller coaster. The mania is the really, really tall peak, but there is a huge crash and a lot of track to navigate at the bottom of the ride as well. And typically after a manic episode, there is a deep and difficult depression, and being there as your loved one crashes to the bottom is just as important as joining them at the top, which is really hard because they've often said things or behaved in ways that really are not lovable. But showing up is sometimes the best thing that you can do. And remember to take care of yourself this whole time so that you have the energy to be there for them too. You have to take care of yourself first to take care of them. And as promised, here's a little something that if you're like, oh, well, that was a bummer on my day, thanks, Liz. Here's something you can actually do. If you, like me, or just you're feeling a little overwhelmed by the size of this problem and you need something concrete to help fight it, you can find your US Senator. I'll leave a link where to find yours down below, and write them or just call them or email them, whatever. Get in contact with them and explain why they should support the Resident Physicians Shortage Reduction Act of 2021. Currently, it is referred to the Committee of Finance in the Senate, so especially if your senators happen to be in the Finance Committee, write to them supporting this bill so it can get passed through there and heard by the whole Senate. This act provides funding to open 2,000 more residency positions between 2023 and 2029 in areas most hurting in the country for providers, with an emphasis on employing residents who come from those locations and represent the populations that they serve, making it more likely that those practitioners will then stay in that area and work there long term. It's not much, but it is something. And when you hear of any legislation that comes out supporting expanding mental health, write your people, vote for that, my friend, and share with others how messed up our system is. Most people have absolutely no idea how broken the mental health system is until they need to enter it or someone they love needs to enter it. And if we all share the news and get mad together, maybe we can get something done. I will leave some resources in the description of this video that may be helpful for you or someone you love if you or they are experiencing struggles with mental health. And I so hope that all the humans who are hurting out there, Gabbie Hanna, maybe you or your sister, I hope everyone can find space to heal, because we all deserve that. And nobody deserves nasty internet comments, so please don't go troll her account from here or critique her. That's not what we were here for. That is not welcome here in my comments either. We are better than that, truly. My friends, I hope you always remember that you are more than enough just as you are. You are not alone, and you can do hard things. Now let's go get mad and change the world, friends. I'll see you later.